The demand is huge and it's growing. Every year, dentists throughout the Western world perform more than 50 million root canal treatments. They're complex and time-consuming, and they don't always succeed. Now a cutting-edge breakthrough promises vastly improved results and clinical efficiency. SAF, the self-adjusting file, from Redent Nova. SAF introduces a new era in endodontics. It's the first and only file that automatically adjusts to fit the root canal, precisely handling all phases of canal shaping and debridement. Instead of the usual array of hand files, a single SAF handles the entire procedure from start to finish. SAF's patented structure and design give it superior strength and durability and remarkable effectiveness. Because it adapts to root canal shape, it delivers exceptional shaping and cleaning, all in a single maneuver, while preventing unwanted thinning of root walls. SAF's unique design enables continuous, simultaneous irrigation of the root canal with any solution desired, preventing clogging while delivering maximum efficiency, improved debridement, and better disinfection. With just one SAF per treatment session, with straightforward operation and no file changes or complex flowcharts, even new users quickly learn to achieve outstanding results. Preclinical trials show the SAF is likely to yield higher success rates than traditional files, even on complex root systems, with shorter chair times and improved clinical efficiency. It's a new outlook on root canal treatment, bringing dentists and their patients a new level of performance, comfort, and confidence, while reducing overall treatment costs. It's the self-adjusting file, the cutting edge in root canal treatment, from Redent Nova.
Endodontic treatment, commonly known as a root canal, is necessary when the tooth pulp becomes inflamed or infected. Causes of inflammation or infection are generally from deep decay, repeated dental procedures on the tooth, trauma to the tooth, or crack or chip in the tooth. Signs of pulp damage include tooth pain, prolonged sensitivity to heat and cold, tooth discoloration, and swelling and tenderness in the nearby gums. If pulp inflammation or infection is left untreated, it can cause pain or lead to an abscess. A root canal is performed to relieve pain and toothaches caused by pulp inflammation or infection and to save the tooth. Most patients report that having root canal treatment today is as unremarkable as having a cavity filled. Treatment. First visit. The tooth is examined and x-rays and a local anesthetic administered. After the tooth is numb, a small opening is made in the crown of the tooth, creating an access opening to the pulp chamber and root canals. The inflamed or infected pulp is treated, and the canals are carefully cleaned and shaped. The canals are then filled with a biocompatible rubber-like material and sealed. A temporary filling is placed to close the opening. Follow-up visit. The temporary filling will be removed as the tooth is prepared to receive a crown as its permanent restoration. If the tooth lacks sufficient structure to hold the restoration in place, a post may be placed inside the tooth to support the core buildup to which the restoration is placed. Most endodontically treated teeth last as long as other natural teeth. Occasionally, the tooth may become painful or diseased months or even years after successful treatment. Often when this occurs, redoing the endodontic procedure can save the tooth.
When the nerve of a tooth becomes infected, root canal treatment can save the tooth. You may realize you have an infected tooth because it's sensitive to hot or cold. It causes swelling and pain, or it gives you a bad taste in your mouth. You may also be completely unaware that you have an infected tooth because you experience no symptoms at all. The white outside of a tooth that you're used to seeing is the enamel. Inside the enamel is another hard layer, the dentine. There's a small chamber at the center of the dentine called the pulp chamber. The tooth pulp is a soft tissue made up of nerves, arteries and veins. The pulp extends from the pulp chamber down through a narrow channel, which is the root canal, all the way to the tip of the root. In general, teeth in the front of the mouth have 1 or 2 root canals, while teeth in the back of the mouth have 2, 3 or 4 root canals. Now, how do teeth become infected? Though some teeth without cavities can become infected, deep cavities are the main cause of infection. Deep cavities can allow germs to get into the pulp chamber. These germs cause infection and the pulp dies. The pus from the infection eventually builds up at the root tip and makes a hole in the bone. This is called an abscess. This cavity entered the pulp chamber here and caused this abscess, which is the dark area at the tip of the root. A blow to a tooth may also cause the pulp to die and then become infected. An infected tooth will never heal on its own, and as it gets worse, it will continue to be a source of infection that drags down your immune system, and that can affect your entire body. This damage to the bone and the swelling inside the bone can be excruciatingly painful and even life-threatening. Years ago, an infected tooth would just have to be extracted. But today, we can save your tooth with root canal treatment.